There we go. And I've let my co-host, my coworkers in, so hopefully they can see the participants and admit anybody else that is still trickling in. So welcome everybody. This is our 6th round of Biotech Infusion. It's great to have everybody here. Happy to, this year we are now calling it the Biotech Teacher Training Initiative. So we still love our rural folks, but we also welcome all of the metro folks that we have not been able to work with for the past few years. So I'll get started with some slides. Oh, you're welcome. Yeah, so hopefully your boxes have arrived. I've been getting a couple of UPS updates that there are still a couple places that are having some issues with supply chain and getting boxes delivered. So fingers crossed those get to you guys as soon as possible so that you can do the labs. Let's see. Okay, change that to meeting group and find my PowerPoint. And remember how to share. Okay, can everybody see the PowerPoint?
Yeah, but you
Okay,
guys
I'm
did potatoes
doing
instead
good.
of apples. Yeah, I decided to do.
Okay, a little mutant. Okay, yep. So please mute if you're until we go probably to the speaker. Okay, so welcome everybody to Biotech Infusion. Happy that we are all here today. So thanks for making it. I know there's a lot that's been going on and is still going on in the state. And I've heard a couple people are evacuating from Florida at the moment or helping family evacuate. So for those who aren't joining live, they will be receiving the recording. Everybody will get the recordings. I'll put them in the Google Drive. So if you miss anything, if you have to step away to go to the bathroom, you can look back at any of the recordings. We'll be recording each of the breakout rooms as well as the main room. So first off, I'd like to go ahead and introduce staff. I think I told y'all it would be later, but I put us in here. So I am Megan Heafy. I run the Biotech Teacher Training Initiative and also for Georgia Bio, the Office of Workforce and Talent. So my background, I'm a former high school science teacher, and I went back to school, got a master's in biology, and then met Maria, who is our boss. And she said, we're going to have money for a teacher training coming up in biotech. And I said, well, I'm a former teacher and I'm getting a biotech degree. So here we are 6 years later. So really happy to be able to support you guys and keep you happy in your classrooms. Mel, are you on?
Yes. Good afternoon, everybody. My name is Mel Carter. I am the Director of Policy and Public Affairs for Georgia Bio. I have been with the organization since January, and prior to that, I was working in Washington, D.C., up on Capitol Hill for a senator from Alabama for 3 years. And then before that, I was actually an elementary education major at the University of Mississippi, but I was one of the COVID grads. So that was in 2020. So very quickly pivoted and found myself working in policy, funnily enough. But so I'm very passionate about what Megan is doing and glad to be with y'all today.
Thanks, Mel. And then if you guys have any questions about how to engage your local representatives and senators, Mel can answer those. And Mel, if you'd like to pop your email in the chat so everybody has it, that would be great.
Will do. And yes, always reach out if there's anything I can do to be helpful.
Yeah, thanks, Mel. And John, are you on?
I'm here.
Hey, John. Go ahead.
Hey, everybody, John Bray here. I'm the Vice President of Member Services for Georgia Bio. I'm responsible for growing our membership base and servicing and improving on the services we provide our existing members. I also manage our Bio Business Solutions program, which brings product savings to the members at large. My background is in medical and laboratory products, services, and distribution sales. And I'm glad to welcome everybody here. You're in good hands with Megan. And thanks for attending. Shoot me a message in the chat if you have any questions as we go along, and I'll be glad to help.
Yeah, thanks, John. And you can put your email in the chat too. So John is happy to talk to you guys about laboratory sales or talk to your students about that.
Yes.
Awesome. And then, so we have our master instructors, Mark, Trisha, and Cynthia. Are you guys able to unmute Mark first?
Hey everyone, I'm Mark Peterson. I teach at Paulding County High School. This is my 20th year teaching, and I am currently teaching AP Physics 1, Honors Chemistry, Biotechnology, Independent Research, and AP Physics 2. And I'm thrilled to be here. It's nice to meet everyone.
Thanks, Mark. Trisha.
Hi everyone, I'm Trisha Peterson. I also teach at Paulding County High School. I currently teach the essentials and applications of biotech, and I have an AP Environmental Science class and AP Biology. And I'm also happy and excited, and there's so many faces. So hi to everyone.
Thanks, Trisha. And Cynthia.
Hi, I'm Cynthia Greer. I'm at North Hall Middle School in Florida. I am a former biotechnology teacher, but decided to switch up schools after 23 years. And now I teach middle school. But I have taught biotech before, so I know what I'm doing.
Yeah, Cynthia knows all the things, and now she is doing them with her middle school students. So she's really happy to be able to help you guys with doing these things with middle school students. Awesome. And so welcome participants. When you get into the breakout room, you guys will unmute and introduce yourselves face to face. But for now, could you please put your name in the chat along with how long you've been teaching, where you're located, and what subjects you teach? That'd be great. Welcome, welcome. And if there's anybody who's attending in a classroom where there's a group of you, please make sure that you put everybody's name in the chat so that we can write attendance correctly. Welcome, welcome. Yeah, so awesome. I really am excited for this group. So I've said before, we haven't worked a lot with the Metro Atlanta teachers because it's been the Rural Teacher Training Initiative, but I'm glad to be able to network you guys. So I have people reporting from all across the state. And I'm really excited for you guys to be able to interact and, you know, meet people from across the state. And you might think that somebody doesn't have as much in common with you, but really you guys are all in the same trenches. And, you know, to be able to have some more support across the state is one of the really great things about this program. Awesome. Watching them all trickle in. So just a little bit about Georgia Bio for you guys. Georgia Bio is here to help Georgia's life science companies with whatever they need. So that fits into these three buckets of advocate, connect, and inspire. And today we are helping you guys to inspire and prepare the future workforce. Georgia's life science industry is extremely strong, and it is COVID proof, as we've seen. So that's one of the industries that didn't drop during COVID. There are plenty of jobs, high paying jobs, some of them that your students can get straight out of high school if they have the right skills. So we'll be showing you guys that throughout the workshop. Here we are in the I changed that Biotech Teacher Training Initiative. So throughout this, you guys will be in your cohorts. We'll have career connections with our guest speakers. We'll be doing the hands-on labs. We have our fabulous master instructor crew to lead you guys. And after the training, you'll be able to pick one of the labs to do with your students. And we will send you everything to be able to do that. We have loaner equipment that I'll talk more about later, and we will send you the kits. So if you teach like 5 sections of biology, we'll send you enough of the kits to do it with all 5 sections. So during the workshop, please participate as much as you can, attend as much as you can. Please plan to have your camera on, especially in the breakout rooms. And let's see. So we'll have an equipment scavenger hunt that I'll post later. We'll worry about that later. Like I said, implement one lab. Please plan to share your implementation. We'll have sharing sessions, which I put the dates in the schedule that's in your binder. We'll have a program evaluation survey, and we'll have an optional focus group. The schedule, I'm sorry we had to move it a week, but the hurricane made it where I couldn't get boxes out. So now the virtual sessions will be on October 8th, 15th, 29th, and November 5th. We are still skipping the 22nd because I'll be participating in the STEM STEAM Forum, and we have the Georgia Life Sciences Summit for Georgia Bio. So we are pretty inundated those days. You all chose one in-person date. I'll be reaching out if you said that you could attend multiple days. But if you had one request, we'll honor that. We'll talk more about implementation in the focus group later. So our fall speakers, I did see that our first speaker, Jasmine Muse, has joined. So here in a second, I will let her start speaking, but you can see at the upcoming dates, we have speakers from across industry, across life science industry. So you'll be able to see kind of the breadth of what's available. I know that students a lot of times only know about being a doctor or a nurse, and they don't realize all of these back-end jobs that really go into supporting doctors and nurses and bringing the technology to the public. So we're really excited to have this group of speakers to be able to talk to you guys a little bit more about careers that your students could possibly go into. So we will do our industry speaker as a whole group, and we'll come back together to do our lab safety to do our lab safety and pipetting labs, the simulations. We'll do simulations, and then you'll move into your breakout rooms to do the glow germ and the actual micropipetting labs with your master instructors. So with that, today's speaker is Jasmine Muse, and one of the things that she has worked on is the Amgen Biotech experience. And Jasmine, I will turn it over to you if you are ready. I'll
Yes,
stop sharing.
I am.
There you
Good
are.
evening, everyone. Hi, good evening.
Hey, good evening.
Right. So I just wanted to speak with you all just about a little bit about me and my career. And then also I'll finish with answering any questions if I can. All right, so currently I work in regulatory at Bureau Biotech. Regulatory, for those who are unaware, is a position that is solely focused on getting a drug or device approved for use. So whether that's in the US with the FDA or it could be in Europe, I work with regulatory authorities to make sure our product is safe and effective. All right, so let's talk a little bit. I just want to share a little bit about my background with you all. I'm sure we have a very similar background. I have a Bachelor of Science from Biology, minor in Chemistry from Prairie View A&M University. That's in Texas, Southeast Texas, for sure. I also earned a certificate in Physiology from Georgetown, along with a master's from George Mason. I'm currently, because I really enjoy what I do, I enjoy making decisions and trying to interact with health authorities to ensure that our drug is safe and effective for use. I'm working on a Master of Science in RAQA, which is Regulatory Affairs and Quality Assurance. I really feel like in my profession, we have to stay aligned with guidances and different innovations, testing, approvals. So many things happen at the same time, and I always want to be in the know of what's happening. So I'm working on now, and then I take my PMP next month. My village, this is like who holds me up, who supports me, who makes everything possible for me, is my husband. So I'm, of course, a wife. I have two little kids, toddler and a preschooler, who keep me very energetic, young, and full of life. I'm a daughter. My parents are a huge part of my support. They don't live local, but they still support us, calling, lifting us up, making sure we're encouraged. I love crafting. So my birthday was a few weeks ago, and I upgraded my Cricut, which I'm really excited about. And I just purchased a new laser machine. So I love crafting. I probably could craft all day, and I would never probably miss a meal because I love making things that is unlike anything else anyone has ever made. And I have my mom friends. So these are my neighbors, a lot of my professional friends. If anyone else has kids, you kind of make friends with the mom, and we all are in similar stages in life where we're, trying to figure things out and balance life and profession. So my village is what I have to support me. Okay, so my organization, it's in the Research Triangle close to Georgia Biotech. Georgia Tech. We're actually right behind Georgia Tech. We share some of the same campuses with Georgia Tech. It's a combination product. So what does a combination product actually mean? That means it's a drug and it's a device. So a device can be a Band-Aid. A device can also be a glucose monitor. Your Apple Watches are medical devices because they're actually, measuring your heart rate. Some have O2 sensors. Your phone, in some instances, can also be a medical device. So there's a wide range of devices. So our combination product also creates a drug inside of the device. It's a respiratory device that delivers nitric oxide to adults and babies as well. So I really take my job serious because I have to ensure that all of our testing is done efficient. I have to make sure that there's no way that we can make a mistake because we want to deliver the best product possible to our patients. So regulatory is what I work in currently. So my journey has been far from like a straight shot. I got my Bachelor of Science, and I was always pre-med. I wanted to be a pediatric anesthesiologist. I did take the MCAT. I did very well. However, I could not. I decided to focus more of my attention on my kids, and I could not sacrifice my family while I, pursued medicine. So first job out of college, I worked as a lab technician. So it was in a chemical facility. I learned all of the projects. I worked in quality control. So I see a few pipettes on the screen. Even though we had used them in undergrad, it was at my first job, a full-time position as a lab technician, that I learned how the process of quality control went. How do we test? What's efficient? How do you prioritize different types of samples? What does quality control mean besides just writing numbers in the box? What is an OOS report, which means out of spec? When do you write a deviation? That means when you have to go outside of your normal guidelines. What's an SOP? It's a standard operating procedure. So if any of you have that Bachelor of Science in bio or chemistry, I'm sure all of you have either seen or have worked a lab technician job, because most college students, that's where they start, because that's where they learn. From there, I actually transitioned and transferred into a different department as a formulating chemist in research and development. So in R&D, I learned how to make the product, how like what type of ingredients go in our product, what's our mixing and blending time, what kind of complaints do we get and how do we reformulate. So this R&D department showed me a different side of the company. Eventually, I worked from Houston, but worked in oil and gas, and I worked as a gas chromatography chemist. So we had probably in 12 hours, we had about 280 different samples to run. We're running different types of olefins, which like sludge, different parts of gas. Gas is refined, oil is refined into at least 100 different products, different types of solvent, everything from the absorbent material in a pamper to the glue that's in a sealant, like the glue in a candy wrapper. We had to test all of those and ensure that they were efficient for use. So lab jobs are very plentiful. It's been my experience that I really, I think I'll never outgrow the lab, but I think that I was ready for something new because it was the same thing every day. You're testing, you're reading your batch records, you know what products come in when you know what they look like, you know what to expect. It's kind of like running a race. You're just getting on the wheel, doing the same thing, and I wanted to learn something different. So I started my MS in molecular biology. Here I transferred from the chemical side of the lab and went into more of, worked on more of a humanistic approach. So here I worked on live cells, worked in a lot of cytology labs, which is just studying various types of cells, worked on non-alcoholic fatty liver disease. And here I really felt like I could see where my career was going. I could see myself for the next 10 to 15 years and where I wanted to go. During this time, I worked for the Amgen Biotech experience. So Amgen has a grant and various cities apply, nonprofit organizations apply for it. And they actually they create professional development and they teach high school and middle school teachers how to integrate biotech into their high schools. So I worked with DC Public School, high school and middle school teachers, not only teaching them how to integrate biotech, but also helping them to write the curriculum and write their lesson plans to integrate into their labs and classrooms as well. I really enjoyed it. And someday I do plan to kind of go back in education, probably once maybe my kids get older. So at this time I went into education for a while. Junior college, high school, I decided to take all of my wet lab skills and I taught high school AP dual credit, chemistry, bio, and environmental science. And I can tell you, I think those were the most youthful years of my adult and career life. I love my students. They were the best. I mean, few of my students taught one of my kids how to swim. I still keep in contact with their mom. I get college graduation invites. I've helped them not only in the classroom, but I've been a really great mentor to them. And they were the best times of my life. We relocated from Texas to Georgia. And during this time, I decided to spend a little more time with my, at that time, newborn. And I decided that I wanted a career that was more so focused on my immediate impact. In education, I felt that I was a really great benefit to my students, but I felt like I was forced to pass them. And I really didn't like that. That kind of really hurt my heart because I feel like I lost my love for teaching. Because I don't want to pass you. I want to work with you and I want to, challenge myself how to teach various populations. So I went into regulatory. This is where I am today. I love regulatory because it's always growing and evolving. No 2 days are ever the same. I'm always pushed and challenged. The FDA We primarily work with the FDA, but the FDA really challenges us on guidances, which is what I kind of wanted to show you guys. So these are a few like terminology words that are very helpful in what I've learned in regulatory affairs. So submissions, anytime that you apply to have a drug approved or you want to change anything about the drug, you submit a package and it's called the submission to the FDA. The goal of that, of anything that you submit, is for the product to be safe, effective, and consistent in quality throughout its cycle. So from the first time it's approved until maybe an update that you might want to have in the market, you have to make sure it's safe and effective. Two differences, I told you, combination products. So a 510K is for drug devices, and then your NDA is a new drug application. So we have to make sure that we are meeting guidelines for both, which means we have to understand double guidances and how it impacts our product. Post-market approvals. So if we want to maybe change the location that our drug is made in, or if we want to outsource the material and have someone else to package it, that's a post-market approval. We would have to apply for that and work with a lot of subject matter experts and follow these different pathways in the guidance. Your DHF. So for an example, we have a device and it's like the size of a shoebox. And anytime that the device goes through a change, we have to look at our design history files. So assessing any change comparable to what's in our submission is what we have to look at. Labeling. So if there's a commercial, a social media campaign, our operator's manual, which is also known as the user manual, packaging label, anything that's on our package, our boxes, anything the customer touches is labeling. Even the front of our device is labeling. So changing labeling, if you want to add an additional letter or have anything underlined, that has to be approved. Guidances I've talked to you guys about as well. Those come from the FDA, and then our SOP I've referenced before as your standard operating procedure. These are all items that we work with from day to day. A few projects that I've worked on in the past, especially in regulatory, is speaking with all of our subject matter experts weekly about changes. So like having a change for how we want to calibrate a piece of machinery, or updating our labeling, that's a discussion. So you can't just change it. You actually have to be approved by the FDA. Something new is called human factors. So human factors is a huge topic that the FDA is really focused on. How a customer interacts with your product, what can be, you have to look at what they see, what they can touch, what they feel. Is there anything about this product that could be detrimental to their health? Is there anything about the product that can be misleading? Any way that the patient can interact with the product and it be used in a way that's different from its approved use. That's human factors. And then submission writing. So when I applied for this job, I knew I had a really strong science background, but I had no regulatory background, just quality, just testing materials. So the person that brought me into the interview, and I thought this was fantastic, was actually married to a retired school teacher. And he said, well, I saw that you were a teacher. And he said, I feel that if you can teach, you can do anything. Because teachers have to understand the curriculum. They have to understand all of the standards from the state or, the regulatory body, and they have to write it for various populations. They have to understand how to effectively communicate to their parents, their administration, their students, and that could range in any grade level, he said. And there are direct characteristics that teachers have that carry over into this position. He said, if you can write your lesson plans and you can write for various populations of your students, you can write for a submission to the agency, which is the FDA. And I didn't see that skill. I was really focused on, breaking down glycolysis or trying to talk about the carbon cycle. I never thought about the day-to-day skills that I possessed as a teacher. So more and more, as I pick up more of my projects at work, I can see how it directly aligns to what I did in education, staying on the schedule, making sure I had those objectives ready for my meeting, following up with the stakeholders is like following up with your students, trying to get them to turn in an assignment, or following up with parents about conferences and staying on top of that communication. Those are the same skills that I use in my job today. I think the one that's most effective for me is asking questions and saying, if you don't understand, ask that question. But then I also would say the second one is being able to teach audiences. So for an example, let's say we have a classroom of students. We have the students that we immediately pick up on the topic, and we have those who we have to maybe teach a few types of ways. Maybe we have a few auditory learners, or we have a few tactile learners. We have to adjust our lecture on the fly based on what administration might have a last minute change. There might be a fire drill. You have to learn how to produce over 150% based on the resources that you're given. Well, that's the same thing that I do in regulatory. I have to make sure that this product gets approved by the FDA, regardless of the resources I have. I have to also make sure that I can teach the agency. I have to teach the patient. I have to teach the respiratory therapist. And I also have to communicate with marketing, which are just looking at the visibility. I have to communicate with the engineers who have a completely different way of thinking. So being able to adjust your techniques and your tools and think on the fly to all of these different types of SMEs, teachers, and I say we because I'll always be a teacher, we do it every day. So I always think about, on the job training and what I wish I knew then that I didn't know before. And honestly, this is just me speaking, I feel that I should have recognized my hidden talents. And now I do. And because I do, I'm unstoppable. And so a few of the important skills: understanding how to interact with multiple disciplines. Sometimes when you walk into a meeting, you never know what to expect. Sometimes you walk into a parent-teacher conference, you don't know what to expect, right? So you can have parents who are supportive, and there are some parents you might have pushback from. Project management, that's simply put, that's making sure that you align your curriculum to your lesson plans. How many items do you have to get done in that 9 weeks? We were in quarters in Texas. Effective communication. We know that some students, you can have it on the board, some will keep up with their planner, and you have those that you have to consistently remind them over and over. What works for the student? Is their Google Calendar, is that working for them? Or do they work better by putting the due date in their phones? Do they work better by having it on the board in front of them the whole time and period? How many times do you have to remind your students of what they need? That's the same as time management with obtaining reports from SMEs. Effective communication, of course, as I said, thinking strategically and critically. What do I need out of person A, B, and C to get to this end goal? Anticipate the potholes. If I know from years before, glycolysis is one that always comes to mind. It took my students a little bit longer. If I spent 2 weeks on it last year, I might need to spend a little bit more time on it this year, or maybe I need to adjust and maybe change my lab and make it a little bit more intuitive. Understanding guidances as well is the same as understanding the curriculum every time the state changes it or adds more items in with less days in the calendar. So I try to think about how my job today aligns with education, and those are kind of like some alignments for you guys. So I have questions. These are my 2 little kids. They keep me going. Literally, one's right here. So if you have any questions, I'm always happy to answer them, and I'm happy to also share my email. with you all, and happy to network and share my email with you all. And I'm on LinkedIn as well. So
Yeah, thank you,
anyone,
Jasmine.
of course, I know that was a lot, but it's like it's so many things I wanted to share.
Yeah, that's amazing. And to
Thank
see,
you.
I think it's great for them to also be able to tell their students, like, you don't have to be stuck in one career forever.
That's right. That's
So
right.
it's okay to go back to school. It's okay to do something else. Don't feel like you've, backed yourself into a corner with any one career. So,
Yes.
yeah, thank you so much. I don't see any questions popping up in the chat. But you guys are welcome to unmute if you do have a question for Jasmine. Oh, where in Texas?
Houston, Cypress specifically.
So somebody asked, what are SMEs?
Subject matter experts.
Yeah. Right. So teacher transferable skills. So y'all, we don't mean to get you to change careers next year. We're here to keep you in the classroom, but just know some of y'all are nearing 30 years and you're still young. So feel free to explore this as a second career. Yeah, somebody just changed to healthcare after being a nurse for 16 years. So it's
Wow.
okay to change careers.
It is. You do what makes you happy.
I know, Christy, you're all thinking it. It's there if you want it, but hopefully we can keep you teaching till you reach retirement age in the school system. Oh my goodness. Thank you so much, Jasmine. And yeah, no worries about the little Klingon. I call mine a sloth. He will not let go. So
No, and they always find you.
I have locked the door today. That is how we're doing this.
Oh, wow.
So thank you so much for joining us today.
Of course.
Any last minute questions from anybody? No, we're all good.
Of course, no
Awesome.
problem. It's nice to meet you all virtually.
Yeah, great to meet you virtually, Jasmine. And I will make sure that your email makes it into the chat so they have it for later too.
All right, sounds great. You all have a great evening.
Yeah, thank you.
Say bye-bye.
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 Gotta love the extra visitors. Mine turned off a Teams meeting the other day, so he's banned from the room for now. I have an almost 3-year-old, so he has octopus hands sometimes. All right, so we have gained a couple minutes back. We're going to move on to the lab safety, which I've seen a couple people actually did already, which is amazing. Let's see, I'll share screen and boop boop. Share. Okay. All right. So for the lab safety, I will also copy that into the chat for you. But today we're going to be completing the lab safety that's available on the NC Bio Network website. This is a really good virtual activity for your students to do as well. So today you guys can just, when you open the link, enter your name, and please send me a screenshot once you've completed it. I've seen a couple people already read ahead and sent that to me. So whenever, we'll take a few minutes to walk through it, and then hopefully you guys can get that submitted before you leave. So I will open it too. And I think I have it set up to do actual screen. So you guys can see that.
Yes.
Yeah, thank you. All right, so you just go to the launch activity and let it load. There you go. And so this is just a virtual lab walkthrough. There we go. So I'm gonna enter my name.
Megan, you want them to send a screenshot to your email, right?
Yes, please. Yeah. So just, I'll pop my email back in the chat.
You got it.
You got it. Thank you. Yeah. So, you can start at the beginning, intro to lab safety, and click through. And there's a lab safety quiz. There are some practice activities. So this is a good thing for you guys to assign your students, as a homework activity, to complete before class. And it shows you everything that's covered in here. Proper attire. And then there's an activity for proper attire. So you can do the activity and you put your person in proper laboratory dress. So pick what's appropriate. Tie your hair back. Something preferably not long sleeved. Pants. And shoes. Oh. So shirt covering all of the torso and upper arms. So there we go. We changed our shirt. And now we're ready to go to the lab. So I guess long sleeve depends on what you're doing. I would say not if you're operating an open flame. So you guys can go ahead and click through the activities. I didn't leave the proper way. Oh, right, because I didn't get dressed again. But I'll let you guys go ahead and walk through that. I'll stop sharing now and see that. I guess I didn't have to stop sharing. I can share my other screen. But I'll give you guys a minute to walk through it a little bit more. And if you have comments on it, you're welcome to unmute and leave them. Yeah, and we like this one because it's free and doesn't require a login. Labster has one that's pretty good, but they have a subscription model, so it is not free. But NC Bio Network has several different labs that you can look through and assign for your students. But yes, when you have completed it, please just send me a screenshot. And if that means taking a picture with your phone, that's fine. It can be potato quality. I don't need, you know, a masterpiece. So while you guys are completing this, one of the things that I've done recently, I've managed to get myself on the workforce board for the Cell Manufacturing Technologies group. And they were talking about what can we do even for graduate students to better prepare them for entering like working in a cell manufacturing environment, which is usually a clean room. So they've said they have a lot of students who don't realize they will be gowned all day. So if you are working in the clean room, you are in there for 8 hours. If you need to go out, a lot of times it's shower in, shower out. And staying in full PPE all day. So the full coveralls, mask, visor, goggles, everything. So it just takes a certain type of person to be able to do that all day. So the more that you guys can expose your students to things like that, the better. I'll talk about the equipment depot more later, but we have coveralls, we have masks, so that you guys can start exposing your students to that environment and see if they can tolerate working 8 hours a day in that kind of equipment. Awesome. And I see your emails filtering in, so thank you guys. Sorry, I'm not trying to put that on that screen. Does anybody have any thoughts about this that you'd like to share? And has anybody used this one before with their students?
It's very interactive, I could say.
Yeah, so it should keep them engaged for a little while, right?
I really did like it. I know oftentimes like our school district sends out what lab safety stuff they want us to use, and we have to use, what they provide and everything like that. But I think incorporating this into maybe a in-class lesson would be a good way, or even as a homework assignment to help continue to reinforce what the expectations are, the lab expectations are. I think would be a good way to do it, because it is interactive. And I do like that it will not let you move on if your answer is wrong, or if you haven't selected all of the items that you're supposed to select.
Yeah, so that's a good point. You can use this kind of in any way that kind of complements what your school already uses. I know when I taught at Duluth, we used the Flynn safety video every year. So it ran in the media center on a loop. And so we watched it at the beginning of each class. So being able to have something to supplement that later on and give them a little bit of review, so they can actually apply the skills that they maybe saw in the video. It's definitely nice and interactive, and it may not be physically hands-on, but it gets them thinking about how they need to stay safe in your classroom. And so today, hopefully all of you have your goggles and gloves for our laboratory portion. We will try to use good PPE. Yeah, they're not the most covering goggles, but they're okay. We're only using food coloring today, and please don't put the glow germ in your eye. That's how we stay safe. Are some of y'all still doing the simulation? Yeah, awesome. Okay, well, I'll give you guys another minute or two to wrap that up. Yeah, and I see Alfreda said she uses it as part of their portfolio, so that's good. And yep, use it as an easy quiz grade. Hopefully it boosts grade morale. Cynthia, I do have enough of the materials for you to let the kids go full PPE. It's a little disturbing how many materials we have. And I'll put something at the end. So we've been working with Emory Healthcare. They have a PPE warehouse at North Lake Mall here in DeKalb County. So maybe you've heard about it if you've been on the newsletter mailing list for a little while. But if not, I will send you guys some more information, and I put a slide here in a couple. But they will have some pickup days available next week and the following week. I think it was Monday through Thursday, 9 to 2, and then Friday, 9 to noon. So you guys are welcome to go there and pick up PPE. They do have boxes of coveralls. They have boxes of masks. I forget what else at this point, but I have cases of bouffant caps at the equipment depot, which is about 10 minutes from North Lake Mall. So you're welcome to do a 2-for-1 and come to both locations if I'm available. We can check if you guys are coming. Are we safe to move on? And I know some of you guys, your computers are not participating nicely with the lab safety simulation. So when you get to a better situation and can complete it, just send me your lab safety screenshot. So I will probably reach out to those who have not turned it in by Friday. The next thing I wanted to highlight for you guys is this pipetting simulation on Lab Exchange. And I will put the link in the chat again. I made it into a tiny URL, but I'll put the actual link in there. Just tried to make it a little easier for you guys to type. But there's a clickable link. So Lab Exchange has a ton of different simulations that you can go through, but we like highlighting the one for pipetting, which is what you guys are going to be doing today. So it walks through how to actually use a pipette. So with the first stop and the second stop, which you guys will explore with your pipette today. But again, it's a good thing that you can have them do ahead of time before they actually get their hands on equipment. Or if they miss a lab, you can have them complete it at home to hopefully speed up the process when they get back to school. So just another resource for you guys to have in your toolbox of bringing in more hands-on labs to your students. So you guys can peruse that at your leisure, and let us know if you have any questions about it. But hopefully that's a useful resource for you guys. All right. Okay, so here is my slide on the PPE pickup. So yeah, he'll be available 9 a.m. to 2 p.m. Monday through Thursday, and then 9 to 12 on Friday for the next 2 weeks. So if there's a time that works for you or somebody at your school, we've had facilities teams come and pick up. You could tell facilities, hey, I want, 10 cases of this and 20 cases of that, and have them come pick it up. That's fine. Just connect them with me, whoever wants to come connect with me, and I will make a calendar invite that puts you on the radar of the person at Emory that is in charge of this. His name is Michael Price. I don't know what his actual job title is, but they've made him a warehouse person in addition to all of his things that he does on campus. So North Lake Mall, which is off of Briarcliff Road in DeKalb. Yeah, I know there are all times that you're teaching, but that he only works weekdays. So I do have some of the items available at the equipment depot. If there's something you're looking for in large quantity, shoot me an email and I can try to get it to the depot so that you can pick it up. I am generally only available Monday through Friday until 4:35-ish. But I live really close to the depot. So if you're coming in on a weekend, I can usually, I can work with you if it's not, something where I'm out of town. So happy to work with you guys on that. But hopefully somebody from your school can go. We have had assistant principals show up, principals, band directors. We've had people bring out the band trailer, the livestock trailer. So anybody that you can get from your school to go pick up materials, these are good for you guys. They're good for agriculture. Yeah. Anybody else that's family can pick up too. I'm happy to connect them, connect all of you with Michael, and get an appointment set up. If you need to like FaceTime in and say, yes, I want that. No, I don't want that. There's cell service. You can do that. So yeah, I think I answered all the questions. But if you guys ever have questions about like I need a supply for my class, come talk to me before you buy it, to see if we have it in the equipment depot. And like over the summer, start your list of what you're going to need for school next year and come to the depot and get what you can from the depot, so that you can spend your money on things that we don't have. So we do not generally stock reagents. We have equipment, consumables, PPE, sometimes large equipment as well as small equipment. So it's worth coming to see what you can get from the depot before you make a purchase. But we will we'll talk more about it next week too, and I'll show you guys some pictures. But for today, it is 5:15. It is time for us to enter breakout rooms, which means I should have stopped before now and actually created breakout rooms. So cool, cool, cool. Let participants choose room, create. I'm going to name them real quick and then we will go into our breakout rooms. I will put up which breakout room you are going into. So we have our 3 master instructors, Mark, Cynthia, and Trisha. Okay. So rooms are open, and here is your cohort list. So Trisha's room is over here on the left, Mark's room is in the center, and then Cynthia's room is on the right. If you are having trouble reading it, just shout out, I can move you. But these are the cohorts that you're going to be in for all 4 of the breakout sessions. Like all 4 weeks. Awesome. Yeah, and I see people joining their breakout rooms. Okay, and I'm going to stop recording the main room.